New at 10 tonight, a Fayetteville Navy veteran is sharing her world of alternative medical treatments. It's a road she went down looking for relief from pain, PTSD, lupus, and other ailments.
She says that some of it has helped, but it's not all covered by the Department of Veterans Affairs. Tonight, we share her story and take you inside the VA, where they have some alternative treatments of their own. Navy veteran Kay Kitterman was once in peak physical condition.
I was also the first female instructor in the Navy in hyperbaric medicine. I was a hyperbaric chamber technician. We taught pilots how to use the recognized hypoxia and use their eject from their aircraft safely.
But with her service,
I was very fortunate to learn a lot. I worked with some great people.
Came struggle.
But I'm also one of those women that went through a lot of sexual trauma.
Plus, she says she was exposed to toxic chemicals at a base and injured her ankle while playing on a military softball team.
I never went to the VA because we were told we had no benefits.
In fact, a survey taken during the 1980s found that 57% of women who served in the military didn't know that they could receive Veterans Affairs benefits. Decades later, Kay finally did go to a VA clinic in Florida for ankle surgery and treatment, but she says it didn't help. Now she suffers from complex regional pain syndrome. She found some relief for that and other health problems through alternative treatments. That includes low-dose naltrexone, medical marijuana, vitamin drips, ketamine infusions, and more.
My first ketamine infusion helped me with PTSD. It was 90 minutes. I couldn't believe it. It was like game-changing for me, and I couldn't believe it.
But it's costing her. She does most of her medical care at a clinic because she says the VA does not cover what she's looking for. She estimates that she's spent tens of thousands of dollars on all this over the years, even showing us some of the bills.
And I don't have the money to continue to do all this.
The U.S. Department of Veterans Affairs declined to do an interview with us for this story, but they sent us a statement saying the VA, quote, supports the evidence-based use of ketamine infusions for treatment-resistant depression and severe suicidal ideation. Many veterans with these mental health conditions are treated with IV ketamine annually, both at VA facilities and by community providers, end quote. And as a federal agency, the VA says it does not get involved in medical marijuana. Meanwhile, we asked the Veterans Healthcare System of the Ozarks in Fayetteville about its support of alternative treatments. They pointed us to a VA-created program called Whole Health.
It doesn't ask the question, what's the matter with you? It asks the question, what matters to you?
It includes therapeutic treatments and guidance developed from studies and research of blue zones, areas of the world where people live long and healthy lives.
We know now from hard science that whole health actually changes our DNA. So there are a lot of biological methods that mindfulness, yoga, healthy diet does in changing our epigenetics.
Dr. Preman Singh, the director of Whole Health at the Fayetteville VA, says this approach produces positive outcomes.
So the positive outcomes we can see are staving off of dementia, prevention of cancer, slowing of aging, prevention of chronic diseases like diabetes and lupus.
There's a team of professionals involved in this program, including acupuncturists, chiropractors, massage therapists, and coaches. There's even teachers leading veterans through art, cooking, and music classes. And when it comes to pain management, Dr. Candy Still with the VA says the clinic has many treatments outside of prescriptions.
So we have a pain interventional physician who can do steroid spinal injections, facet joint injections, nerve blocks, radiofrequency ablations. We have dry needling available, biofeedback, alpha stem. We have gamma core, which is a new treatment that is specific to treating headaches.
She adds that their approach focuses on more than the physical ailments.
There's a big psychosocial component, and you've got to have mental health involved with chronic pain care.
Doctors at the VA tell us they are always looking to expand what they can offer as long as there are rigorous studies and research showing those treatments are proven to work. As for Kay, she hopes speaking up about what has worked for her will inspire more veterans to do the same.
You know, I think the VA needs to maybe study a little bit about what some of us are doing. I've made it this far. I'm like whack-a-mole. I joke about that. You knock me down and I come popping back up somewhere else.
And for veterans who don't know where to start, the VA says it can walk you through each step. Something to note, veterans can choose to have another person with them at their appointments if they're nervous about getting care, and they can schedule a ride to and from the VA.